My name is Dr. Tushar Mehta. I'm from Canada, and I did my residency there in family medicine. I've also practiced addictions medicine, and I've mostly practiced emergency medicine, or what you call A&E in some countries. I have an interest in international health, and I do work in India and a few other places. And on top of that, I have a strong interest in plant-based diet and health. So when I say plant-based diet and health, you can also say vegan diet and health. And I'm here on behalf of Hina Modi and plantshift.com. Okay, this time we're going to talk a little bit about breast cancer. We're going to shift gears a little bit because we have, when we talk about overall cancer mortality in the previous video, you can get enough numbers where you can get statistical significance in some of our, in our data. Now we're going to cover a few studies that that are not exactly the same as the prior ones. So the first one we're going to talk about is Breast Cancer Research and Treatment. That's the journal's name. Premenopausal dietary fat in relation to pre- and postmenopausal breast cancer, published 2014 from data collected from the Nurses Health Study. And what they did is they followed 88,000 women aged 26 to 45, and they went from 1991 to 2011, so pretty much 20 years. They found that those eating more animal fat and cholesterol type foods had a greater incidence of cancer, about 18% greater amount of cancer. Those eating red meat had more cancers. Okay, so again, this is not a study that shows that has a vegetarian subgroup. What it's really doing is just dividing people into there may be all people who mainly are not vegetarian, but dividing people into those who have the lowest amount of meat, medium amount of meat, and higher amounts of meat, and comparing the low consumers to the high consumers. Maybe a vegetarian group would do even better if you had enough of those people to get statistics on them, but they didn't in the study. They didn't look at that. They just low compared to high consumers, and they found there was an 18% difference. Okay, so that's interesting that those people consuming more animal products have a greater amount of breast cancer. Another study published in 2007 from the British Journal of Cancer, Meat Consumption and the Risk of Breast Cancer in the UK Women's Cohort Study. What they did was they took 35,000 women who were cancer-free at the time, aged 35 to 69, and watched them just for 8 years. So it's just see how many cancers happen over that 8-year period. It's always nice to even look longer to see if there's a greater difference, but 8 years is still not bad, and they did find a difference. They found that those people who were eating animal products had a 20% increase in cancer. That's similar to the last article we said, they're both at a similar rate. Again, they're not comparing vegetarians. Maybe there would be vegans that have a better, possibly have a better outcome because there's zero animal protein intake. But those in the higher compared to the lower animal protein intake groups, the lower ones had about a 20% improvement. Now, some meats were worse than others. Processed meats gave a 65% increase in cancer, and other forms of meat had, as I mentioned, 20% increased risk. So now there's a few more studies in the reference list that show similar results. People having more saturated fat, that's basically animal fat, okay, having a certain percentage of 15-20% more cancer than those consuming less. So let's look at some other factors about breast cancer. And I'm going to talk about soy in a second here, okay? So other factors that influence breast cancer, there's a few of them. Diet is one of them. We talked about saturated fat, which basically comes from animal products. But let's talk also about the amount of exercise, age of pregnancy, breastfeeding, smoking, family history. Those are all other factors that influence breast cancer as well. Some of them are modifiable, okay, and some of them are hard to modify, but women who breastfeed have less breast cancer, and non-smokers and so forth, okay. Alcohol intake is another factor. Lower alcohol intake or no alcohol intake means less breast cancer, all right. But let's look at soy. Soy is a food where a lot of people have praised it so much in the 80s, and then later on demonize this food. What happens is that there's a lot of anything that's popular or interesting, suddenly you get people saying that, oh, this could be bad for you. Another thing that happens is that industry realizes that this is a big threat to their profits, the meat, dairy, and eggs industries. If people start eating soy, they're going to have less of their products, and they stand to lose billions of dollars, and indeed that's what's happening. So they fund a lot of things that come into media and social media that soy is really bad for you. Now, the Eastern countries, what they found was those people who were consuming the most amount of soy had somewhat of a decreased breast cancer, and the rates range, depending on the study, between advantage of 20% to 50%, as compared to the Western studies where there wasn't so much of an advantage. Now, the difference between those two studies was that in the Eastern studies, people actually had 2, 3, and 4 servings per day of soya foods. So a lot of soy. Whereas in the Western countries, there was very, very little soy consumed in comparison, because it's traditionally not a food that people would eat so much of, okay? So they're not necessarily looking, these studies, looking at vegetarians versus non-vegetarians. They're just looking at people who consume more or less soy, all right? And what they found, as I mentioned, 20 to 50% less cancer in the higher soy consuming groups. But it's not one of those things where everything in moderation is a mantra that you can use. It's the people who are having the higher amounts who got the benefit. And those people having lower amounts in moderation of soy didn't really have much of a benefit. It was the high amount of soy, people having 2, 3, 4 servings per day, probably for a long time in their life because they traditionally ate that much. Those were the ones that had a benefit. Okay, so that's a very interesting thing. Now, soy has something called isoflavones, and what they have is a very tiny, tiny, tiny bit of estrogen effect in the body. Okay, now estrogen chemistry is very complicated. We have different estrogen receptors. Men and women have these receptors, different kinds, and also different kinds of estrogen. Now, in many cases, estrogen has to fit into it's like a lock fitting into a key fitting into a lock, that stimulates an estrogen response. But with these isoflavones, they're kind of like a key that fits into the lock, but it's not a perfect key. It doesn't fit perfectly into the lock, so it has a very small effect. But in many cases, when an actual estrogen comes along, a real animal estrogen, that basically is blocked by the partial estrogen that's in the receptor. So the net anti-estrogen effect can also be there, okay? And this applies to men and to women. Another interesting thing is that animal foods contain actual animal estrogen. Dairy contains estrogen because a cow, even if organic, is pregnant and then lactating. And she has a lot of estrogen in her body, much of which goes into the milk. It helps the calf grow faster, okay? But for humans, it may help cancer cells grow faster or have other effects on things like heart disease. Eggs also have some estrogen because the female hen is always ovulating. It's the ovum, and there's some estrogen there. And when people eat meat or fish or poultry and they're actually eating the flesh of an animal, that flesh contains animal estrogen, just physiologic, normal hormones for that animal, but they're in the body and people consume them. And that type of estrogen has a very strong effect on the human body, okay? So this paranoia about isoflavones is a lot unwarranted and kind of mythologized, but people are still concerned about it. So what they do is they also said, well, what if you have breast cancer, you're a breast cancer survivor, and you have more soy? So there have been a number of studies like this one I'm going to talk about, and it's called Soy Prevents Secondary Breast Cancer Recurrence in the Journal of the American Medical Association, one of the top 5 journals of the world, published 2009. And what they found was they had 5,000 breast cancer survivors in China, right? Again, in China, because some people consume a lot of soy there, all right? And they followed them for about an average of 4 years, and they found that there was 30% less death in the group that consumed the most soy. And there was also 30% less overall recurrence of cancer, all right, in those who consumed the most soy foods compared to those who consumed the least. And the benefit was for estrogen receptor positive cancers as well as estrogen receptor negative cancers. So interesting study. Now that's just one study. If I took that study and I really believed it and took that to be factual, I'd be out there telling all breast cancer survivors to eat lots of soy because it's going to prevent death, okay? But one study isn't enough for me to really say that kind of strength to everybody. I think it's an interesting study. It's a good study. We need more data. If you look into the reference group the references that I've provided, there are actually a few more studies that also looked at a similar population, anywhere from 1,500 to 5,000 breast cancer survivors. Those consuming more soy had a mortality benefit. Okay, so there's a few studies that have reproduced this result, but again, we're not, cancer is a tricky business, and I'm not going to start telling the audience that you got to consume this much soy to prevent cancer and also to treat cancer, because I feel that we could still have more data on this subject. But we got a few pretty good studies, all right, and let's see what more comes down the line to see about prevention and treatment of, not just treatment, but prevention of primary cancer, but also prevention of secondary cancer in breast cancer, when we're talking about breast cancer here, right, in those consuming more soy. Okay, so right now it's very optimistic. Possibly there's enough data to recommend it, but I'm still going to be careful with the audience and say let's wait for more data also. But this is pretty good so far. All right, so that's that one. So the references for every single video that I have are going to be downloadable from the description box, where you can click and download the entire set of references, and then just scroll down to the relevant references. If it's a video on diabetes or cancer or something like that, scroll down to the relevant section and take a look at the references that I'm speaking about. In my videos, I'll generally discuss one reference, but it's going to take too long to discuss 10 references and you'll be bored out of your mind. So I'll discuss one, and then you can go into the reference list and look at more references that are talking about the same topic. And it's important not just to have one reference, but to have multiple references that discuss a topic, because then you're seeing that different studies are being done in different places by different people, and they're getting similar results that are reinforcing each other. Okay, so that's another good thing to look at.